Here's a video of a patient of mine that's 2 days after surgery had a total hip replacement. She doesn't use a cane, doesn't use a walker, so this is 48 hours after total hip replacement. I challenge you to tell me which side we did, because I can't remember. This is a patient 1 day after surgery. He's doing stairs. I had a lady came to the booth and asked me, well, when can I start going up and down stairs? And I said, after about a day. This is a lady 1 week after surgery, and you can see she's in her mid to late 70s. And she's walking up and down the stairs, and she's really not doing too badly. When I did this video, I found out that she actually drove herself to the clinic a week after surgery, and I fussed at her because they're not supposed to drive. So, but hey, you can lead a horse to water, right? So when we looked at our data, and we followed our patients, and every one of our patients is part of our database, and we collect outcome data. This is the length of hospital stay at Memorial City. Of my patients prior to doing the anterior approach in yellow and after doing the anterior approach. And you can see that our patients stay about half as long as they used to just by changing the surgery approach. The same physical therapists, same nurses, everything is the same, just the difference in approach. When we looked at where do our patients go, do they go to rehab facilities or skilled nursing facilities? No, they don't. They go home. Over 90% of our patients go home after discharge. This is what I'm really proud of. These are patients, the first 200 that we did. And we asked all of our patients, every one of our patients got a prescription to physical therapy. And I thought that had a little higher compliance rate. But you can see from that graph that 43% of my patients never went to physical therapy, even though I gave them a prescription. So I need to work on that. And this is using an assistive device such as a cane or a walker. And you can see that 73% of our patients do not use a cane or walker 2 weeks after surgery. This is just a little animation that shows how we do the surgery. This is actually the resurfacing animation, but the surgery is essentially the same. The patient lays in the supine position on the operating table, and then we make a small incision right where your pocket is, where you put your wallet. So we don't take your wallet during the surgery, so not to worry. So we'd make a small incision there. You can see that. And you see no bleeding whatsoever. And you can see how we split the muscles apart. So we don't cut the muscles. We just lift them to the side, and then we go deeper. And the hip is actually a much more anterior joint than a posterior joint, so it's easier to get to the hip through the front. Then we coagulate just one of the vessels, one of the smaller vessels, and then we take out the anterior fat pad. And then we incise the capsule. And then we're already at the hip joint. Then when we do a hip resurfacing, we have to dislocate the hip first. And we've actually had really good luck. We've done about 30 anterior hip resurfacings. And I think there's only about 5 or 6 surgeons in the United States that do that. And we've had quite a bit of response from patients far away. Had a lady from Venezuela that came in yesterday. So then we dislocate the joint. And in the resurfacing, then what this special table does, and thanks to Memorial City who has purchased this for us, it allows the hip to be hyperextended, adducted, and externally rotated, which now perfectly positions the femur so that we can prepare the femur through the small incision. We put on this guide and pin it in position, adjust it, make sure it's done just right. And we drill a hole. And we just resurface the joint. See why orthopedics is so much fun? We get to use all these fun tools. And then we put a head on there, and then we proceed on to prepare the socket. This still requires hands on. The only robotic surgery we can do currently is a partial knee replacement. And we just got FDA approval for a bicompartmental knee replacement with the robot. And we're working on using it for the hip as well. And then we put the final implant on, which is usually cemented into place. And then we use that fancy table again, bring it back up to normal rotation. And then we reduce the hip. So that's how we do the hip replacement through the front. Actually, if you want to watch this again, you can go on YouTube. It's on YouTube. I mean, nowadays, YouTube is your solution to when you miss something in the news. If something is exciting in the news, just go on YouTube, Google it, and you'll find it.